Hi everyone, welcome back to my channel. My name is Becky Setra. I hope you're doing well. Thank you to all of you who are my returning subscribers, and if you haven't yet subscribed to my channel, please do before you go away. So I've started a new series and it is more educational than anything. As you may all be aware, we have all come here as nurses and healthcare professionals, and we worked hard to get our registration. And when you get the registration, it's important for you to look after it. We have told you in all our or most of our videos about how you will relocate to the UK, but not much about what happens on the ground. So this series is about educating you about what can go wrong. Most often you'll find, if you stick within the standards and follow the protocols. I have been here, as I always say, almost 20 years, and I haven't actually had any problems. So, it's unlikely you would have any problems. But if you have relocated to the UK as a nurse, make sure that whatever you do, you stick to the NMC Code of Conduct. The first of them is treat people as individuals and uphold their dignity. You should listen to people and respond to their preference and concerns. You should make sure that people's physical, social, and psychological needs are met, and you should act in the best interest of people at all times. And also, you should respect people's right to privacy and confidentiality. So those are the codes of the NMC, or some of them. Now, what are some of the reasons why somebody could get struck off the NMC register? The first could be due to misconduct. Another one, lack of competence, criminal convictions or cautions. It could be due to health, not having the necessary knowledge of English, so that's why they expect us to do the English test. Determinations by other health and social care organizations. So another organization can determine that you are not fit to practice, or they have concerns about the way you practice, or finally fraudulent or incorrect entry on the register. So these are some of the reasons that can lead to you being struck off the NMC register. So today I'm going to be talking about a case whereby NMC struck off a registrant on the grounds of misconduct. I'm not going to say too much about this. The person doesn't work anymore as a nurse, but it's just for you to know some of the reasons. So this person was referred to NMC by her own employers on about 11 different charges. So the first charge was the fact that this nurse slapped or hit a colleague at work. The second one is the fact that this nurse was reported to have shouted, "What are you doing?" or words to that effect at a patient's daughter. So she shouted at a patient as well, apart from shouting at the daughter of this patient. And also, the third charge was the fact that she failed to insert a cannula in a patient's hand in a competent manner, in that she caused or permitted a piece of plastic to be partially inserted into the patient's hand. So I'll talk briefly. So for the first charge, which was her slapping or hitting somebody, when I read her statement, she said she was trying to tap this other nurse to gain her attention. She didn't slap, but apparently, according to the other nurse, it didn't hurt or it wasn't painful. However, it made her jolt. So they ended up taking it as it must have been very forceful enough for the other person to have jolted, although she said it wasn't painful. The other one about the shouting at the patient's relative and the patient as well. According to the nurse's own statement, she said when that is how she talks. Some of us, especially from certain parts of the world, when we are talking or chatting, we talk a bit loud. That is how we talk, but that can be perceived by other people as shouting, I would say. I do even say in my own house, when someone is on the phone in this house and I'm walking from outside, I can hear the person. They're not shouting, they're just having a chat with someone on the phone, but it's so loud. So, yes, in our different backgrounds, that is how we do. But over here, when we, especially Africans, we are talking in certain situations, we are perceived to be shouting, probably even if you don't think you are shouting. So this is to my fellow nurses, overseas nurses who are coming to the UK, just make sure when you're talking to people, make sure you are careful, you know how to pitch your volume of speech, because it can be misinterpreted as shouting. I don't know the case, I wasn't there, so I can't say, but that is how somebody talking loud, or maybe the tone or however she said it, was interpreted as her shouting at the patient and a relative. And in her statement, she reported that is how she talks. Although at the end of it, the patient's daughter said when she spoke to her in a different area after that, what happened, she wasn't shouting. So it was concluded somehow that she may have shouted. Anyway, so the one with the cannula, and they said a piece of plastic was partially inserted, that actually was not really proved. It seems like, yes, something happened, but not quite as it was. So the fourth charge was that this lady went to the theater area to speak to a doctor in an area where you have to be scrubbed up. You should be sterile, I would say. But she was wearing her uniform and entered that area, and she was asked to leave promptly. But she refused to do that. So that's another thing. And another charge was the fact that she failed to safely prepare a patient to receive IV infusion treatment, in that prior to the treatment, she did not conduct or instruct another person to conduct certain tests. For example, urine dipstick, which is urinalysis, blood sugar test, temperature, and pulse and blood pressure. So these were not done, and she didn't do it herself, and she didn't ask anybody else to do it. Another one as well is that she failed to check the care record and documentation to ascertain whether the tests or observations referred to above had been carried out. Another charge was that she failed to take a patient's blood prior to starting intravenous infusion. Another charge was that she failed to insert a cannula into a patient's hand in a competent manner. So I read a little bit about that bit, and what it said was the fact that she went to insert the cannula and she did not take everything she needed. So something happened and there was bleeding, and she didn't have anything to stop the bleeding. So she was going forth and back. And if you're new and you're not sure about what to do in any situation, please make sure you ask. If you don't feel competent and confident to do something, please ask and make sure you have the training. I know they assess you and make sure you can do something before they left to do it, but I don't know what happened in this case. Another charge was on the fact that she ignored the instruction of a nurse in charge of the shift to stop treating a particular patient. I think a patient became upset about the way things were going about their care, and the nursing charge asked her to stop treating that particular patient, but this person did not listen and carried on. Another charge was the fact that this nurse manually handled the patient in an incorrect manner, in that she held the person by her arm in order to move her. So she was trying to help someone to get into the chair and held the person by the arm or elbow or whatever he said. And as we know, there are manual handling protocols we have to follow. So if you want to handle somebody, make sure you follow the manual handling protocols or procedures in your trust. What I would say is that people watch. I have heard from a lot of nurses who contact me about situations they find themselves in. They come here as overseas nurses. Some people, some healthcare assistants or other staff see them as they are not competent, not understanding that they came from a different area and the way things are done there are different. These nurses have several years of experience, and all we need is to support them together. I don't know what happened in this particular nurse's situation. I don't know how many years she's been practicing here, so I cannot comment on that. But I'm just saying, to any new nurse in the UK, make sure you look after yourself. Make sure you ask if you're not sure. Now, after incorrectly handling a patient, which is by holding her on the arm or by the arm, she was asked to document this incident in a clinical incident form, and I think she did not do that. She did not do that. So these are the 11 charges that were brought against this particular nurse. Also, one thing you should be aware of is the fact that those of us from Africa, especially black nurses, we are more likely to be reported to the NMC as compared to any other person. So if you're like me, please be careful. People watch you, and yes, so far as you're doing the right thing, you're following your procedure and everything, you would be fine. And definitely, it doesn't just take one day for you to be sent to or referred to the NMC. I think there were a catalogue of issues. People have made a lot of complaints. In this case, they did not just get to the final decision just like that. There have been a lot of statements from the patients themselves, the patients' family members, and other staff members in that hospital, and the employer, the matron, and everybody. So just again, one thing to let you know, if things are going on in your workplace and you feel that, make notes. I always say make notes, keep a note, keep records. If something goes wrong, write a statement, write something, and keep yourself. If you need to report it, report it. And just make sure you follow the standards, you follow the protocols, and you will be fine. But I think it's important for you to know what happens, certain things that can lead you to be referred to the NMC. I'm just going to briefly read through. So this person on a particular day slapped a colleague while the colleague was speaking to another patient, and this registrant that has been struck off stated that she tapped the colleague to get her attention. So she said she did not slap. Now, on another time, this nurse accompanied, on another day, a family accompanied her mother to the hospital and sat with her in a waiting room as the mother was agitated. So apparently the mother had Alzheimer's. So it is alleged that the registrant, who is the nurse, was not happy with this and shouted at the daughter of this lady. On another time, on another date, this nurse tried to insert a cannula into a patient's hand, but ultimately failed and allowed a piece of plastic to be partially inserted, which I talked about already. Another time, when she was trying to speak to a doctor, she entered a scrubbed up area and in an operating theatre whilst wearing her ward uniform, which is in contrast to the trust policy. It is further alleged that she was advised to leave, but she refused to do so. Now, another time, she failed to safely insert a cannula in another patient's hand, and the person was bleeding. I've talked about that already. On another date, a patient had a fall after fainting, and the nurse tried to help the patient up by herself. So if someone falls, call for help. You don't handle the person yourself. According to, she did not do that, or she did not follow the trust manual handling policy, and without asking for help, she subsequently failed to record whatever happened in the nursing notes and also to complete a clinical incident form. So if someone had a fall, you have to complete an incident form. Read all your hospital policy so that you know what to do when something happens, So what happened in the end, in a nutshell, I don't want to bore you too much about the whole incident because, as I said, the hospital matron from that hospital gave statement. Family members, her colleagues that she worked with were all asked to give statements, and she herself gave statement. And at the end of it all, what I would say, the one that they said a piece of plastic got left in somebody's hand was not proved. The rest were proved by her own admissions and from what other people have said. And in the end, what happened was she was actually suspended for 18 months. That is what happens with NMC cases. Before you are struck off, she was given 18 months, and within that 18 months that you can appeal. And if you haven't appealed and that time comes, then you will be struck off the register and you cannot work as a nurse any longer, especially in the UK. So I hope you have learned something from this case. It's a series I thought I will start and briefly talk to you about some of the things that people get struck off by, or the reason why people get struck off, so that it can help you when you are practicing. So you make sure that you are on the top of your game. If you're coming to the UK, it's not easy. I always say that I would never paint a wrong picture about how things are to you. I'll tell you the truth. But if you follow protocols, policies, you'll be fine. But if you don't, people are watching you, what you do. Just make sure you do the right thing. If you don't know what you're doing, ask. If you're not sure how to use an equipment, please ask and you will be fine. So I hope to share more with you very soon. Take care of yourselves. Look after yourselves. Look after your registration. And I will see you soon. Remember to like, subscribe, and share. Bye-bye.